Hello and a very warm welcome to the Westbrook Family Dental podcast. I'm Dr. Jaydeep Sehgal, and I'm delighted you've joined us today.
I want to start today by asking you to do something that might be a little uncomfortable.
Okay.
I want you to just mentally scan your body right now.
Yeah.
Just a quick check-in, shoulders down, jaw unclenched.
Mm-hmm.
Okay. Now picture this. You're on your couch, you're staring at your phone. You know you have to make a call, just one simple appointment.
I know this feeling.
And right away, your palms get a little sweaty. Your stomach does that thing where it just tightens into this cold knot.
Yep.
You put the phone down, you say, I'll do it tomorrow.
Mm-hmm.
And then tomorrow becomes next week. And next week,
Yep.
well, it becomes 5 years.
I can feel the tension just listening to you describe that. It is a universal paralysis. And the thing is, it's usually not because someone is lazy or disorganized.
No.
It's a visceral physical reaction. It's a specific kind of dread.
Exactly. And today, we are ripping off the Band-Aid. We are doing a deep dive into the things so many of us avoid, dental anxiety.
And I want to be really clear about this up front. Before anyone, hits the stop button.
Right.
We are not here to lecture you about flossing.
Oh, thank goodness for that. I think if I heard one more lecture on flossing, I'd just scream.
No, absolutely not. We're looking at a set of excerpts from the Compassionate Care series, specifically the philosophy of Dr. Jaydeep Sehgal at Westbrook Family Dental.
Okay.
And our mission today, it isn't about cavities or root canals. It's to analyze a really profound shift in medical thinking. We're looking at moving from a model that's all about the procedure, fixing the tooth,
Right.
to a model that is focused on psychological safety.
I have to say, when I first looked at this source material, I just breathed this huge sigh of relief. This isn't a checklist of things I'm doing wrong.
Mm-hmm.
It feels much more like a guide for the terrified.
Yeah.
It's written for the people who would rather do literally anything else, jump out of a plane, hold a tarantula, than sit in that chair.
And that is such a significant distinction. Historically, the medical narrative has been, here's the problem, here's the fix, now sit still while I do it.
Yeah.
Very paternalistic. What Dr. Sehgal is presenting here is an acknowledgement that for a huge chunk of the population, the barrier isn't logistical. It's not about time. It's emotional.
It's fear.
It's fear. And unless a professional validates that fear, instead of dismissing it, no amount of logic is going to get that patient through the door.
Okay, so let's unpack this, because the source material starts with this direct address that I found really powerful. Dr. Sehgal basically says, if picking up the phone makes you sweat, this is for you.
It's immediate validation. He's not talking to the brave people. He's talking to the avoiders.
Right. And he lists these specific triggers. He talks about people who maybe had a rough experience 10 years ago, or, the classic scary childhood dentist.
Oh, we all have a version of that story.
Don't we? The smells, the sounds, that stern face looking down at you.
Those are powerful sensory memories. They're called flashbulb memories. But what's fascinating here is that the source also highlights a secondary trigger, one that is often overlooked but might be even more powerful than the fear of pain, and that's the shame factor.
Oh, this one is huge. The embarrassment of having waited so long.
Precisely. It becomes this vicious cycle. You don't go because you're scared. Then time passes. A year, maybe a decade. Now you don't go because you're embarrassed.
You imagine the lecture.
You imagine the moment you open your mouth, you're gonna get a lecture. You imagine the dentist looking at you with disappointment or even disgust.
Like you failed a test you didn't even know you were taking. You feel like a naughty kid in the principal's office.
Exactly. And Dr. Sehgal addresses this head-on in the text. He explicitly says, we are not here to judge you or tell you it's silly.
That phrase, it's silly, is so crucial, isn't it?
It is. Because how often is fear just dismissed as irrational? By saying clearly that the fear is valid, he removes the shame. He disrupts that cycle. He's basically saying, we don't care how long it's been. We're just glad you're here.
And he digs into the why of it all, which I found so insightful because, nobody loves pain. But he suggests the root of dental anxiety isn't really about the pain. It's deeper than that.
This is the core psychological insight of this whole deep dive. Dr. Sehgal argues that the anxiety stems from a loss of control.
Okay.
I mean, think about the physical posture of a dental patient.
Yeah, let's just paint that picture for a second.
You are lying back. You're in a supine position. Now, in evolutionary terms, lying on your back with your throat exposed is, it's a position of ultimate submission.
Right. The most vulnerable position you can be in.
For any mammal. So your lizard brain is already screaming, danger before anything even happens.
Yeah, the amygdala is just firing off warning shots.
Correct. And then add to that, someone is hovering over you. They're in your intimate personal space. They're literally working inside your head. You can't see what they're doing. And this might be the most terrifying part. You can't speak.
That's the kicker for me. Your main way of saying stop or help is just gone.
It's gone. You are surrendering your autonomy. And if that person hasn't established deep trust, your brain perceives it as a massive threat. So the pain, or even the fear of pain, it's actually secondary to the fear of being trapped and helpless.
So it's what psychologists call learned helplessness.
Exactly that.
So if the problem is a lack of control, the solution has to be giving that control back. And this is where it gets really interesting. The source introduces a specific tool. Dr. Segal calls it the stop hand.
It sounds so simple, but in practice it is. It's revolutionary.
It really is. So here's how he describes it. He tells the patient right from the start, you are the boss, not me. Which, I mean, I've never heard a doctor say that.
It's a complete inversion of the traditional hierarchy. The doctor's always the authority figure. Here, the patient is the CEO of the appointment.
Totally. And the rule is simple. If you feel uncomfortable, or even if you just need a break for any reason, you just raise your hand slightly.
It's just a little wave.
Yeah. But I want to pause here because I know what some people are thinking. Oh, yeah, I've raised my hand before, and the dentist just keeps on drilling.
Right. The classic, just hang on, almost done, let me just finish this one little bit.
Yes.
That's a betrayal. It ignores the signal, and it just reinforces that lack of control.
Yeah.
But Dr. Segal's protocol, as it's described, is strict. He says it means stopping immediately.
No questions asked.
No, let me finish. It means tools come out, the patient sits up, and you take a breather.
He explicitly says you are in the driver's seat the entire time.
I love that analogy. It just changes the whole vibe.
It does.
It goes from something that's being done to you to something that is happening with your active permission.
It creates psychological safety. Think about it like driving a car. If, with 100% certainty that the brake pedal works, you aren't terrified of going fast.
Right?
But if that brake pedal was, optional, or the car sometimes argued with you before it stopped, you'd be a nervous wreck. That is a perfect analogy. If I know I can stop the roller coaster isn't scary anymore.
Precisely. And the data actually backs this up. When patients know they have that stop hand option and they truly believe it will be respected, their pain threshold goes up.
Wow.
Because they aren't bracing for impact. They can actually relax.
So we have the psychological framework, validate the fear, give control back.
Hello and a very warm
But the
welcome
source
to
also
the
spends some
Westbrook
time
Family Dental
on,
Podcast. I'm Dr.
the
J.D.
ghosts of the
Sagal,
past.
and I'm delighted
Ghost of
you've joined us
dentist's
today.
past, if you will.
Right. Because Dr. Segal points out that a lot of us are operating on data that's like 15 or 20 years old. We remember that distinct smell and the loud, high-pitched whine of the air drill.
We're judging a modern experience based on obsolete evidence.
Yeah.
It's like being afraid of flying because you saw a biplane from 1920.
He talks about the sensory changes. If your memory's filled with loud noises and discomfort, that's what you expect. But the source emphasizes that the reality today is, well, it's quieter. It's faster.
The technology has advanced specifically with patient comfort in mind. Drills are electric now, which cuts down on that high-pitched vibration. The imaging is all digital. It's not just about clinical efficiency. It's about the user experience. But beyond the gadgets, there's a philosophical shift the source highlights, which I think is even more important.
Is this the people first concept?
Yes.
Yeah.
The Westbrook motto mentioned is people first, teeth second.
That's a strong statement. I mean, it sounds like good marketing, but how does it actually play out?
It signifies a move away from treating a mouth or a case. In the old model, you walk in, you're a set of molars that need filling.
Right.
In this model, you are a human being who happens to have teeth. It prioritizes the emotional state of the human over the clinical needs of the teeth. If the human isn't okay, the teeth can wait. If you're having a panic attack, we stop. We don't push through.
And that leads perfectly into what I think is the most surprising offer in this whole source. I read this part twice just to make sure I got it right. Dr. Segal offers what I'm calling the zero pressure option.
This is a brilliant example of what's called a soft entry.
So get this. If you are terrified, like really, really terrified, he says you don't even have to have an exam on the first visit. You don't even have to sit in the dental chair.
Which is the primary trigger object, right? The chair. That's where the trauma lives.
Exactly. He says the first appointment can just be hanging out, a private room, a normal chair, like a living room chair. You can have a coffee or a water, and you just chat. For 15 minutes.
Think about what that does to the dynamic. It removes every single clinical barrier. There are no bright lights in your eyes, no bib, no tray of scary metal tools in your peripheral vision.
Nothing.
It's just two human beings in a room building rapport.
It seems so simple, but I have never heard of a dentist offering a coffee date as a medical appointment.
It's all about establishing safety before attempting a procedure. If you don't feel safe with the person, you certainly won't feel safe with the tools.
That makes sense.
By allowing the patient to come in, look around, meet the doctor, and then leave without anything scary happening, you are literally rewriting the brain's association with that building.
You're retraining the brain. You walked into the Dragon's Den, you had a coffee, and you walked out unharmed.
Exactly, you survived. And that one small victory builds the confidence for the next step. It proves that the stop hand concept applies to the whole relationship, not just the procedure. You can stop before you even start.
Okay, so what does all this mean for someone listening right now? Someone who is maybe nodding along thinking, okay, that all sounds nice, but I am still freezing up at the thought of actually making the call.
Right.
The source actually gives some really specific practical advice for this.
And the advice is a little counterintuitive. Do not book the appointment.
I love that advice. Don't do it yet.
Not yet. Dr. Settle suggests taking baby steps that carry zero commitment, because commitment is scary.
Step 1, just go to the website.
Yeah.
That's it. You don't have to call. You don't have to fill out a form. Just open the browser and look.
And specifically, look at the photos of the environment. The source notes the office is designed to look more like a living room than a clinic.
Right?
Just visualizing the space can help demystify it. If you can see it doesn't look like the sterile, scary dungeon from your childhood, if you see warm lighting and comfortable chairs, your anxiety might just tick down a notch.
It makes it real, but in a safe way.
Exactly. And the other thing he suggests is social proof. Read the reviews. But not just any reviews. Look for the ones from other nervous patients.
You're looking for your tribe. You want to see if other cowards, and I use that word lovingly, have survived this.
There is immense comfort in shared experience. Seeing that someone else, someone just as terrified as you, who maybe hadn't been in 20 years, went in and came out smiling, that validates that the promise of compassionate care isn't just marketing copy, it's real.
It's seeing the evidence that the stop hand actually works for other people. It makes you think, okay, if they could do it, maybe I can too.
It builds trust by proxy.
And the closing sentiment of the source is really just a reiteration of that promise. When you are ready, we are here. No lectures. It puts everything on the patient's timeline.
And that no lectures part is so key. It circles right back to the shame we talked about. The promise is that you can walk in with a mouth that hasn't seen a dentist in a decade, and the response is going to be support, not scolding. They're treating the future of your health, not judging the past.
So let's wrap this up. Let's look at the big takeaways. If you are someone who deals with this specific dread, the sweaty palms, the knot in your stomach, what have we learned? First, your fear is valid. You're not being silly.
It's biology, not weakness. You're reacting to a primal loss of control.
Second, the solution is to get that control back. Tools like the stop hand aren't just polite suggestions. They are hard boundaries. You are the boss.
You have the brake pedal. And if a provider doesn't give you that brake pedal, you should find one who does.
And third, you don't have to dive into the deep end. You can wade in, start with a website visit, graduate to a coffee chat in a normal chair. You can test the waters without risking any trauma.
You know, if we connect this to the bigger picture, beyond just dentistry, it's a reminder of what patient-centered care should look like. In any medical situation, you should never feel like a passive object on a conveyor belt.
Right.
You are the protagonist of your own health journey. You should always feel like the boss of your own body.
That is such a powerful perspective shift. It's not about enduring something, it's about collaborating.
Precisely. It turns the doctor from an authority figure into a partner.
So I want to leave you with something to think about today. We've talked a lot about fear and anxiety. Here's a question. If a medical environment causes you anxiety, is it really because of the procedure itself? Or is it because you haven't been given the authority to say stop?
That is a profound question. You know, perhaps the cure for this kind of anxiety isn't bravery. Perhaps the cure is agency.
Agency. The power to just raise your hand. Something to mull over the next time you look at your phone and dread making that call. Just remember, start with the coffee. Thanks for diving in with us today.
Take care of yourselves.
See you next time.